Hi, I'm Ratul. I'm really excited to be here. I'm the founder of BEMPU Health, and I wanted to start off by telling you a little story about this mother here. Her name is Divya, and she lives just down the street from our office in Bangalore, India. And when Divya had her first baby, that baby was born small, about 3 pounds. And when she took that baby home, 3 weeks after she took that baby home, she noticed that something wasn't right. So she went back to the hospital, and the doctor diagnosed her baby with a late-stage infection. 4 hours later, her baby died. This is Divya with her second baby, Ritiksha. I'll tell you a different story about Ritiksha in a little bit. But Divya's story was not uncommon. In fact, almost 5 out of every 100 babies born in the world don't make it to their first birthday. And this was something that I found appalling. So back in 2013, I spent a year in the field in India, in hospitals and clinics, trying to understand firsthand for myself why babies were dying and what I could do about it. And what I focused in on was low-weight babies, which are the ones that are at highest risk of dying. And when I looked at the literature, I saw that we know why these babies are dying, and we know what we could do about it. And so I focused in even further on one specific problem, hypothermia. And what I found was that hypothermia management, or preventing these babies from being cold, can prevent almost half of these babies from dying. So my team and I focused on this problem, and what we developed was this tiny bracelet here. The bracelet is given to a small baby when they're discharged from the hospital, and it monitors their temperature day and night for 1 full month. If the baby's warm, it keeps blinking a soft blue light. If the baby's ever cold or hypothermic, it sounds an alarm, it blinks a red light, it wakes up the mother or the father so they can warm the baby well before the baby has low blood sugar, has trouble breathing, has brain damage, or dies. And when the baby's warm again, it starts blinking a blue light. But something different happened for Ritiksha. In the middle of the night, her bracelet was beeping. And the mother, Divya, tried to warm her baby, but it kept beeping for 2 hours. It stayed orange and red. So Divya took her baby Ritiksha back to the hospital, and the doctor diagnosed the baby with an early infection that was presenting as persistent hypothermia, or cold for the baby. And if we can catch infections early for babies, especially the small ones, they have much better chances of survival. So we built this bracelet, and we started selling it to private hospitals in India, online, to distributors, but we really hit a note with some public health agencies, especially UNICEF, who had a priority around preventing death of small babies in the home setting. And we sold our bracelets to UNICEF in Benin, UNICEF in Zimbabwe, Papua New Guinea, and we also started working with the Indian government. And the Indian government asked us to do something interesting. They asked us to do a pilot study in the state of Rajasthan with some of their government neonatal intensive care units, catering to some of their most critical babies. And they asked us to monitor a cohort of babies. Some of the babies received the bracelets, and some of the babies didn't receive the bracelets, and we monitored the outcome. So babies who did not receive the bracelets, about 14% of these critical babies went home and died within the first month of life. On the other hand, babies who received our bracelet, about 6% of them died when they went home within the first month. And so in this pilot study, babies who had the bracelet had about a 57% better chance of survival than babies who didn't have the bracelet. And in my mind, this lined up to the research I'd done earlier with the Lancet and other publications about how powerful prevention of hypothermia could be. So we then got the Rajasthan government, who is scaling us up to 3,000 units, and we have 7 other states in India that are taking us forward in their budget. We were also selected in Time magazine as one of the top 25 inventions of 2017. And last year, I got a great opportunity to present to Bill Gates and the Gates Foundation directly, who later went on to fund us. Something was still bothering me a little bit. We were able to get the death rate down, but when I was in the field and my team was in the field, we realized that the other reasons why these babies were dying were still preventable and things that we could address. So my team and I have now a portfolio of products under development that offer a holistic package of solutions for our customers to help reduce neonatal mortality. So where are we now? We have a good bracelet. We have a good device that works. We have customers in some of the largest global health organizations. We have support from some of the largest public health funders in the world. But how do we actually make an impact? Well, there are about 130 million babies born every year in the world. 20 million of these babies are low weight. These are the critical babies. And 8 million of those low weight babies every year are born in India. So how do we get to these babies? Well, our plan is to develop rigorous clinical evidence that really helps us get into sort of policy level decisions around, with the government of India, UNICEF and WHO around hypothermia management. We're attacking private and public markets, and we're launching a whole suite of products that give us a complete offering for our customers. We've been fortunate to raise $2 million from the Saving Lives at Birth partnership between Gates Foundation, USAID, and others. And we are seeking $1.6 million in funding, which helps us unlock a matching grant from Grand Challenges Canada's program called Transition to Scale for promising health ventures. This is one of the best parties I've been to. This is Divya and Ritiksha, who invited us, me and my team, to Ritiksha's first birthday party. Ritiksha made it. And with your help, I'm hoping we can help 1 million babies per year get to their first birthday party too. Thank you.